According to the WHO, smoking kills over 8 million people annually worldwide. Out of these 8 million, 1.3 million people die from secondhand smoking.
And did you know that secondhand smokers, so actually non-smokers exposed to smoke, are at risk of having 20 to 30% of heart disease and 20 to 30% of strokes?
It's a shame, actually.
Welcome to your show, DocTalk, where we discuss important health topics in a simple language so we can help you to understand illnesses and symptoms more clearly. I have my colleague, Dr. Sundos, and me, Maraheb Alqalaf, and you figured what we're going to talk about today, which is
smoking. People think that smoking is just a bad habit and it only gives you bad smell, bad breath, and people will just think that you are tough and or you're cool.
Yeah,
exactly.
It's cool
and
to
this
smoke.
is where actually in the past they are promoting that if you are cool or part of a gang or be someone very important.
I remember this very famous ad actually in a big yacht, a man with a big yacht and, you know, having fun, smoking, which is actually, it's a shame. This is not the lifestyle that you want because smoking causes lots of health problems.
And you know why, Maraheb? You know that smoking or cigarettes contain more than 7,000 harmful chemicals and substances in them, including tar, formaldehyde, and acetone, and also nicotine. And this is really harmful. And out of those 7,000, 70 components of them actually causes cancer directly. So this is really harmful and this is really something serious.
And we can notice also heavy smokers, they end up, most of them having cancer, lung cancer, throat cancer, and the rarest kind of cancer like gum cancer also, which is, you know, it's very severe and significant, and sometimes it's not reversible and cannot be treated, unfortunately.
And don't forget the cardiovascular system also. Smoking affects the cardiovascular system where it causes hypertension, sticking to the lining of the blood vessels, where it causes stroke, where it causes infarction, where it causes a thrombus formation, and it may lead to death, so, and myocardial arrest. So it's not something simple, and it's a shame, Maraheb, because most of the diseases, you have nothing to do with them. You cannot prevent them. Acquiring bacterial infection, viral infection, autoimmune diseases.
It's not something you do it on purpose,
exactly. But this is something that you can prevent, and you are the one who's causing the harm to yourself.
Well, true. And in this episode, actually, we're going to cover not only problems with the smokers, I mean, in health, but also secondhand smokers. And most people are unaware of what is the meaning of secondhand smokers. So secondhand smokers actually mean non-smokers, like children in the house being exposed to smoke, or other people, you know, sitting in a restaurant, you're the smoker, but the other people are not smoking, exposed to your smoke.
And that's why now we have seen the changes in the past recent years, that they have prevented smoking in closed areas, where you can see in the malls, in the restaurants, in the airport. If you want to smoke, there is a designated area for smoking. You go there, and anyone who smokes outside that area, then there will be a big fine to them, and it may lead to jail even. And the people think that smoking is only including cigarettes, but we have many forms of smoking. We have the cigars, we have the electronic cigarettes,
shisha also,
exactly, or the hookah, and we have the electronic cigarettes, electronic vaping. All of these cause the same harm to the lungs, and unfortunately they don't only cause the harm directly on the lung, but also for those people who are struggling or battling with obesity or uncontrolled diabetes. There are hidden sugars, especially in the electronic cigarettes and vaping, when they have flavors, and the hookah itself, it's the same thing. They contain hidden sugars. So if you are battling with weight or battling to control your blood sugar, you will not be able, as long as you are consuming the vaping and hookah. So you need to stop them in order for you to get what you are aiming at.
And smoking is smoking. There is no alternative. So some actually advertisements they do say for vapes especially, it is a safe alternative for, you know, regular smoking. Nicotine is nicotine. Tobacco is tobacco. There is no safe alternative. They still cause the same harm to the body, because your body is treating this as something very harmful, and the body has to defend itself.
And you know, Maraheb, it's not only that, not the nicotine Maraheb, it's not only that, not the nicotine actually only the one that is causing harm. It's the other substances with it that is causing harm. So don't think that you took out the 7,000 ingredients in the cigarettes, then you are safe, because the alternatives, the chemicals that are in the vape and the electronic cigarettes, they might cause even more harm. And now we are seeing in the social media and in the news that there is a lung disease, a very rare form that is on the rise, because people are more now smoking, vaping and electronic cigarettes.
You know, you just reminded me of a case actually. It's the cousin of one of my friends, and he used to actually use a safe alternative for smoking, vaping. And it was discovered that he had actually lymphoma, Hodgkin's lymphoma. So it's kind of like complicated. So is it something genetic, or it's something triggered by the vape? So it's very interesting.
This is the problem, And the effect is not only on the person itself, as you said. Sometimes it may lead to infant death. So sudden infant death syndrome is linked to parents who smoke, whether the father or the mother, or even both of them. So if they are smoking, even if not inside the room or inside the house, the smell and the particles resides on the clothes are causing the same problem. I think we gave a brief introduction and a very nice introduction regarding today's topic, and now we come to discuss what are the effects of cigarettes on the body, and what are the complications that we can see after the break. Stay tuned with us. Welcome everybody to our program DocTalk. Today's topic is very interesting, and it is very common, and unfortunately, Maraheb, as we said before, now we see it on the rise. And unfortunately, some of the videos I saw on the social media and on the news, that kids now in some of the areas or the countries are even smoking. Kids who even not older than 5 years of age and 6 years of age are holding cigarettes and they are smoking. So it's really not good. And I like how now they started, some of the countries, they are blurring any visual picture of smoking, whether it's cigarettes, whether it's a packet, whether it is vaping. They are blurring it on movies, on TV shows.
It should have been this way for so long, because children actually pick up those behaviors, especially if it's seen in the whole environment, right? Some people would say, especially parents would say, no, it's okay, my child doesn't understand what's going on. No, it starts with imitating and mimicking the behavior. Especially, you can notice also if a child holds like a chocolate pretending to smoke, and this is something very, it's not cute, it's significant, and it shows that the child understands what's happening.
Definitely. And I had one patient, actually a teenager, who came to me, and the father just discovered that his teenager boy is smoking, and he was telling me that please advise him about the effects of smoking and how does it affect the body. Then I told him, and I was discussing with him, and the child was looking at his father. Then I asked the father, are you a smoker? And he said, yes, but I'm an adult. I told him, no, you cannot ask a person to do something while you're doing it. You need to set an example. A smoking mother, a smoking father is not a good example for the children. They're going to grow and think that this is something normal, or this is a ritual. We grow up on it, and we need to do it in order to be part of the family. So the effect of cigarettes is not only on the body, it's also it will affect the fertility of the person.
Definitely.
So it will cause disfiguration of the sperms. It will cause low mobility. They will be very slow in motion. And you can know that by putting them and seeing in the microscope that this person is a smoker. And we have seen many videos on social media setting an example about the difference between a smoker and a smoker father. And the same thing applies to the mother. It will cause irregular periods. It will cause abnormal shape of the ova. So it has multiple complications. Now, if the mother is pregnant and she continues on smoking, which is another catastrophe, and I think she should be taken to court, because she's not only harming herself but also harming the baby.
It causes birth defects also,
exactly,
right? And
preterm delivery, prematurity, intrauterine fetal death, where the baby dies inside the mother wombs. It will cause congenital heart disease, where a simple defect into a very complex congenital heart disease, it will cause brain defects, smaller size babies, even if it's term, but the baby will become smaller in weight and delayed growth. So this is not a simple thing that you can do. When you breastfeed, the same thing, and this is the second-hand smoking, and also the sudden infant death syndrome. So it will also be, especially if the mother is smoking and breastfeeding.
Yeah, definitely. And it can also transfer from the mother's body through the milk into the baby.
Yes,
so those tiny, whatever you put into your body is going to go directly to the baby. And also, not to mention, Dr. Sundos, smoking actually causes many types of cancer, right? And especially for my specialty, speech therapy, we've seen so many cases of laryngectomy. It's caused by, it's a surgery actually to remove the larynx. Here, this area,
the voice box.
The voice box, exactly, because of smoking, actually. And it's something major, because you not only lose your voice, you lose your swallowing ability. It's something major. We actually function on feeding, swallowing. The voice box not only produces the voice, it protects your breathing, your trachea, or the windpipe. So it's something very major. And here comes speech therapy to find a way for safe feeding, and also inserting like a speaking valve to allow the patient actually to talk and have a voice.
Definitely, and not only smoking causes social distance, because the smoking person, whatever perfume you put, whatever method you try to do,
the smell is still there.
Exactly,
you can't
it's still
just
there.
Hide it.
Exactly, but also you cannot hide it from your face and fingers. I have seen many people who smokes for a long period of times. There are stain of nicotine on their fingers, and you can know which hand they prefer, because the stain, you can see
and
it more.
Discoloration of
Exactly, it is yellowish in color actually. And it will cause also gum disease, gum staining, teeth staining. So it's not something that is good, and it will cause bad breath also, because it will also affect the stomach. So it's not only causing diseases inside, but also from the outside people will notice it.
And especially for women, you see increased wrinkles, right? Deep wrinkles, and you cannot hide it actually. So we've seen so many actually videos and photos of, you know, females being compared, non-smokers to smokers, and you can see a huge difference in the physical appearance and you know, the facial appearance.
Definitely. And you know, smoking, as we said, it's sometimes not only affect, most of the times actually, not sometimes, it will affect the residents with you living in the house.
Family members.
Uncontrolled asthma, continuous cough in children or other family members. When you go and dig a little bit deeper in the history, if there is any smoker in the family, and then you will notice that the father is a smoker or the mother is a smoker. I had it many times in cases of uncontrolled asthma, and I will ask the father, why you are still smoking? Your child is admitted every few days to the hospital. And he will say that I remove my dishtasha, the traditional clothes, and then I take a shower, and then I go and hug my children. Why does it still cause harm? And I tell him, because it sticks to your skin.
Yes.
So you
Remember,
carry it.
there are particles actually.
Exactly,
You cannot run
exactly.
away.
So the harm,
Yeah.
and remember that, dear viewers, is not only to yourself, but you are also causing harm to your surroundings and loved ones. So it is the best time to quit is now. Don't delay it.
Yes.
I think we covered most of the things, Maraheb, and now we come to the final segment of our episode today, which is the how to quit smoking and what are the support group that we can do in order to quit smoking. But after Healing in a Plate segment, stay tuned with us.
Welcome back, dear viewers, and we're going to talk now about how to quit smoking actually and how to manage it. We've seen so many people actually saying, I'm going to quit tomorrow on Sunday or by the weekend. And, you know, setting this target has to be very clear and precise, right? And you have to set a plan. You have to make up your mind. It needs determination. It needs support, not only by you. You can't even support yourself by yourself. So you need to surround yourself with a good support system, whether your friends, your loved ones, or family, or maybe seeing a professional like a psychologist or a psychiatrist to prescribe some medications, you know, to help you to quit smoking.
You know, smoking is part of addiction.
Right.
And like any other type of addiction, we are addicted to medications, chocolate, certain types of food, shopping. Most of women are traveling.
So every person has actually special interest. When it's over or excessive, it becomes an addiction.
Exactly. And this is where people think they can vent. So people think if I quit smoking, I don't have another way to vent. And this is where
it feels so empty, right?
Exactly.
So they get used to a habit of, you know, holding the cigarette and inhaling something.
Yeah.
So when you quit it, like we say cold turkey, you cannot, because you feel so empty. You're used to doing this habit over and over. There's no replacement. So one of the actually ways in therapy to stop smoking is to replace it with something healthy, like a healthy habit.
And you know, Maraheb, this is a valid point, because people will come and say, whenever I hear a person who wants to quit smoking, the other people sitting around, they will say, it's very hard to quit.
It's not.
How are you going to quit suddenly? You need to do it gradually. And this is wrong. If you want to stop, then you have to stop. You don't do it gradually.
You don't look back.
Exactly. And if you cannot do it, you have to know this is, as we said, addiction. You need to find the reason behind why did you start smoking in the first place. And then after dealing with this problem, then stopping smoking and stopping any addiction will be easy for you. It's worth mentioning that in all the primary healthcare clinics in Kuwait, there are free of charge smoking clinics where there is a specialist. They will give you a protocol on how to stop smoking, what to do and what to look for. If you have a setback, if you crave one cigarette, what to do.
And if you've encountered triggers, right?
Exactly. And then they will give you follow-up if they see that you cannot control by yourself, you are going back again to smoking. So they will give you alternatives. Exactly. So they give you patches, they will give you nicotine gums, they will give you alternatives. And then they will continue following up with you. They will have a psychologist, psychiatrist, social service, support group. All of that you will find free of charge. So why you are still continuing smoking?
There's
you can
no
have
excuse.
it. Exactly.
There's no excuse. Everything is available to you. So you only need to take an action, a serious action. It just needs a strong will and a support system.
Support system. Support system is very important. Surround yourself with a really good support system. Anyone who are pulling you back, who are judging you or telling you that you cannot quit smoking. Oh, see, you went back and smoked one. This is not good. We knew that you will relapse. Get away from them. These are the negative people that you don't want to surround yourself with. Surround yourself with positive people who will give you encouragement and push you to be your best. The good news, and this is just a push for our dear viewers who are smoking and trying to quit, you know that within 6 months only from quitting smoking, from your last cigarettes, even if you were smoking for 20 years, within 6 months, your lung will rebuild itself back, and it will be back to normal. So all your risk factors, all the phlegms that you're having in the morning when you're waking up, because we know
the persistent coughs.
Exactly, the cough with the phlegm, it should be together. We know that you are a smoker.
I was actually telling Dr. Sundos behind the cameras, we can actually notice who's a smoker or not from the cough. Because smokers tend to have, you know, this excessive phlegm when they cough.
Yes.
And you can notice it. It's
exactly.
Something you cannot...
You know, but it will disappear within 6 months after smoking, stopping smoking. So this is really good news, and you can start now. If you care about yourself, if you care about your loved ones, then today is your day.
Every second counts, actually, for your health. If you want to have a healthy body, it's never too late. You just need to take the step, take a serious step to fix your life and have a healthy life.
Definitely. And as we said, it's not only the effect on your lungs, the cancer risk, the fertility risk. Everyone wants to start a family, build up a future. You cannot do that if you are smoking. Also, your loved ones in your surroundings, your kids, your children, all of them will face the complication of smoking as if they were smoking, all because you are smoking indoors or even outdoors.
Right.
So also don't forget, there are certain things that you can do. Meditating, breathing exercises, relaxation exercises.
Working out and physical exercises actually help. If you want to have a healthy life, quit smoking, eat healthy, make your diet better, right?
Exactly.
Full of omega-3s, antioxidants, rich in fiber. All of this will just, you know, develop healthy habits.
And it will help to reduce the stress. So you don't feel the need that you need the cigarettes in order to reduce the stress that you're facing. So you can do relaxation exercises. You can seek always the support group, a supportive person, a specialist, whether psychologist, psychiatrist. All of these will help to reduce your stress and help you in your decision of having a better life and better future for yourself and your loved ones.
Right. And also, not to mention, there are actually ex-smokers groups, right?
Yes.
Where you have to actually do your investigation to find those groups, and it's going to help a lot to, you know, talk about your feelings and how smoking affected your life and how stopping smoking actually made your life better.
Exactly. I think, Maraheb, we covered most of the things and tips and points regarding smoking. And I hope, our dear viewers, you benefit from the tips and points we gave you today regarding smoking. Remember, having a healthy life and a good, healthy future is your choice. You can either start now or you have the alternative. The decision at the end is yours.
It's never too late to quit smoking. Start today.
Have a good day.